Good afternoon. Welcome to the Monday, April 26th Maricopa County Board of Health meeting. And could we get a roll call, please?
Good afternoon, members of the board and public and speakers. This is Vera Sampler. I'll start with the roll call. Supervisor Bill Gates. Supervisor Bill Gates, do you need to unmute yourself? Don Casano.
Present.
Dr. Deborah Boldoff.
Present.
Deborah said good. President McMillan.
Present.
Kristen Acton. Paula Bonahan.
Present.
Dr. Stander. Robin Schaefer.
Present.
Scott Seeley, VP. I'll go over for one more time. Supervisor Bill Gates, are you present? Is that an echo? Supervisor Bill Gates? Scott Seeley?
Yes, present and unmuted.
And Kristen Acton? No. President McMillan, we do have a quorum with 6 members present. I'll turn the call back over to you.
Very good. Thank you for the roll call. Okay, is the call to the public. The public will be automatically muted here on this call. However, we're requesting if they request comments or want to address the action items, can they please raise their hand virtually? And can somebody who's more technologically inclined than I am explain what the public should do virtually by raising their hand or typing in the chat in the chat box? Can somebody help me with that as far as how they would raise their hand here?
Absolutely. Members of the board and all public guests, at later time during the meeting, should you wish to comment or raise your hand virtually, you may do so by using the webinar bar to your right, usually, of your screen. There's a virtual raise hand that's green, or either you have the option of typing your chat. The moderator will look at the chats during the meeting and before we conclude the meeting so that President McMillan can make those announcements or address any comments or concerns. Thank you.
Thank you. Do we have any members of the public at this time that wish to speak? Is there anybody that we can see on the screen here?
There are no raised hands.
Okay, thank you. Okay, so the actually the second agenda item will be whether we approve the January 26, 2021 Board of Health Finance Committee and the Board of Health minutes. Has everybody had a chance to review the minutes? And if so, do I have any motion? Are there any changes to the minutes that anybody has? Anybody have any changes to the revised minutes that were published?
President
Do I have
McMillan,
a motion? Yes. Yes.
There were
yes.
some corrections with the red line copy that was emailed to all board members. So if no one has any objections, that would be the motion to accept the changes, if that's okay with the members.
Yes, that's of course. I did receive that by email, and if nobody else received those, and we need to get those to them right away. Did everybody receive revised minutes by email? And if so, is there anybody that has issues or wish to change anything that they believe is incorrect?
No. Mr. President, this is Scott. I would move adoption with the edits.
Okay, so we have a motion to adopt minute. Anybody with a second?
This is Don, Mr. President, this is Don Casano. I would make a second to that motion.
Okay, so can I have a vote for all those in favor of approving the minutes of the Board of Health and the Board of Health minutes, the Finance and the Health? Can I get a vote of everybody who wants to approve them? Can they say aye, please?
Aye.
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 And if anybody does not want to approve them, can they say nay, please? Okay, we have a motion to approve the minutes. Would you like to have any, Vera, would you need to have anybody call out their names as far as when they approve and they say aye? Would you like us to call our names out on that? Or are you okay just to listen to the nays and know that you've got everybody on board at that point? What would you prefer?
Thank you. When you're calling the motion, if you can just state your name for the minute's sake, that would be awesome, and I'll record it as such.
Okay, thank you.
For the vote, not necessary.
Gotcha. Thank you very much.
Thank you.
Okay.
By the way, this is Paul Stander. I did just call in.
Welcome, Paul.
Thank you.
Okay, we're on the third item now, the approval of the bylaws. Has everybody received the bylaws for the revised bylaws for the Board of Health? And is there anybody that did not receive those? Does anybody have any comments on the bylaws that were printed as far as changes or ideas?
This is Paula. I just have one question.
Mhm.
Under Article 3, number 8, the Board of Health shall annually review the health status report of Maricopa County. Does that come out as a report for the public? And the reason I'm asking is because I'm always doing searches for, cardiovascular disease statistics for the county and for the state. And what's on the internet right now is like in the early 2000s. So I'm just wondering if this has anything to do with that.
Okay, I believe the changes, did you get the red line version of that?
Well, I'm just looking at the number 8, which the only thing that they took out of number 8 was the word "the." So it's
Right.
still, we still supply that report. And I'm just wondering, could I look at the last report? Are they open, and where would I find them?
Okay, can someone help me with that as far as where that information will be contained?
This is Vera. I will forward you a copy of that. I am not sure currently if it's posted on our website or if it's something that's archived, but I will find a copy and I will post it, and it'll be recorded properly in the minutes for this conversation. Will that do?
Yes, that will be great, Vera. Thank you.
Thank you.
Thank you, Vera. Okay, if anybody has any changes again on the minutes, then can they make themselves known here? You could please let us know. If not, do I have a motion to approve the minutes, the revised bylaws for the Board of Health? Do I have a motion for that?
Mr. Chairman, this is Don Casano. I would make a motion to approve the Board of Health bylaws and with the recommendations.
Okay, do I have a second?
This is Paula.
Second.
Second.
I'm sorry, could you repeat who made the second, please?
This is Paula, and I initially made the second.
Okay, thank you. Do I have a vote on the minutes? Excuse me, on the Board of Health bylaws? All in favor, say aye, please.
Aye.
This is Ann.
Aye.
This is Ann
Those
Longo.
are-
If I could,
Aye.
Yes, go ahead, Ann.
I'm sorry. The motion should be to approve them and make a recommendation to send up to the Board of Supervisors for approval, because it's the Board of Supervisors that actually approves revisions to the bylaws.
Thank you, Ann, for clarifying that. Do we have a motion to make a recommendation to the Board of Supervisors to approve the revisions?
Mr. Chairman, this is Don Casano. I will correct my motion to state approval of the Board of Health bylaws and forward a recommendation to the Board of Supervisors for their approval.
Thank you. And do I have a second?
Yes, this is Paula again, and I'll second that motion.
Thank you, Paula. May I have a vote for everyone who wants to approve the recommendation to send to the Board of Supervisors for the revised bylaws? Please say aye.
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 Those opposed, say nay. The motion carries. So we have a recommendation for the Board of Supervisors to approve the bylaws.
Mr. President,
Yes.
this is Scott Seeley. I just, this these virtual meetings tend to be a little, how do I say, a runaway train in terms of moving forward. And I look forward to us getting back together and being able to talk a little bit about some of these things. And there may be a more appropriate time later in our meeting, but I think the point Robin was making is a very significant one for our body. We've had a lot of developments in the last year and a half in public health in Maricopa County. And, you know, I've asked some questions in prior meetings where we didn't have the data yet. We didn't have the information, but there are, I think, coming out of COVID, going to be some significant data around health issues for our community that we do need to, as a board, I believe, kind of ask for information and get more updated information about what we were learning through the COVID experience, especially, and Robin, this may be where you were headed too. I'll just give an example. It appears, this is maybe anecdotal, but it appears that obesity has been a huge contributor to serious or fatal COVID experience. And if that is true, which I believe it is, then one of the things I'd like us to talk about is whether going forward we would have opportunity to pursue some initiatives, support the department in its efforts and other things related to some of those underlying health issues for the community that maybe put us in, that caused much more harm over the last year and a half than needed to, because of existing public health issues, if that makes any sense. So Robin, you raised the issue, I think, around the bylaws as far as how recent is the health reporting that we have access to, but I'd like to make sure we can talk about that some more and what sort of data we have available and what we are able to do with that information.
Yeah, thank you. This is Robin. I just want to clarify that was Paula, but as Robin, I totally agreed with it. And Paula's question, although it had nothing to do with approving the bylaws, Paula, correct me if I'm wrong, that you just wanted to know where that health status report. I'm new to the board, so I haven't seen it this year, but it looks like that this board annually reviews the health status report. And so it was just your clarification, and I totally agree that, where is that report and, when do we get it? Is that correct, Paula?
That is correct. This is Paula. Because it's really, really important going forward, is I'm sure you will agree, that the cardiac consequences of COVID, as well as lung issues and clotting issues, it almost looks as though we're creating an entirely new group of diseases that are going to be in the next 20 years. And something that's really affected a lot of people, especially in the rural markets, is that not only were there no physician appointments available for anything other than COVID, but in the rural markets, there was absolutely no access to prevention. And I would love to see this committee take a very strong stand on prevention, because we're getting into the time frame when a lot of us baby boomers are hitting, as they call, the pig through the snake, and the demand on our medical institutions, our personnel, is going to explode. Not to even mention what COVID has done and what we're soon to be finding out in trickles and drabs.
Yeah, I don't want to get too far off the agenda here. So the idea would be to put on a future agenda to discuss the health status and the health report.
Okay, very good.
Would that be right? We want to put that on a future agenda item.
Okay, be happy to.
And Vera, would that be something that can you help me out with how that process would take place as far as a future agenda item? Is what's been said enough, or? Okay, maybe she's on mute. All right, we'll see about maybe adding that to the future agenda item. Okay.
Great.
Okay.
Thank
you. Sure.
I would say if it's the will of the board, that's what we will do. If it sounds like there's consensus here that we want to dig into this, then we ought to say we will have it on our agenda going forward. And if subsequent conversation is necessary to get the right information in front of us, but punting this a quarter at a time doesn't give us the chance to dig into this detail and start hopefully leading some discussion as Robin and Paula just described it. So
Ms. Longo, can you give me advice on whether that's appropriate, that we can control the agenda in the future? Is that within the board's realm?
Yes, it can be added as an agenda item for a future meeting.
Okay, gotcha. Thank you, Scott.
Yeah.
So let's add that to the agenda.
This is Dr. Stander. I'm not to belabor, but I mean, I totally agree with the comments that were made there about it is important for us to discuss this. I don't know when the report is completed or, but we might want to just say it will be reviewed by the board at a targeted quarter one, a specific meeting that's most germane to when it's completed. I assume like the 2020 report was completed at the, in the first quarter of 2021 or something. So I would just say we ought to have it, maybe if we could, target it at a specific meeting each year, if that makes sense.
Right. It does make sense. How would health then, exactly when the Board of Health, the report is complete? I wonder, would Marcy probably know that?
Good afternoon, members of the board. This is Marcy. Certainly, they're typically completed on an annual basis here in Maricopa County. I don't know what their date of completion is, but I will work with our epidemiology team and ensure that it is on the agenda to discuss the report every year on the month that it is created.
Great, Marcy. Thank you for that. Does that satisfactory to the board?
Yes,
Yes,
Robin.
thank you.
I think it makes sense.
Yeah, and my request is that Vera had said she would send the report to Paula, but my request is that from last year, just to please send it to all of us.
Okay. Vera, can you do that for us, please? Okay. All right. So go ahead with the agenda then for the next item. This we're on number 4, excuse me. Now, typically, the Board of Finance Committee has met previous to this meeting. The meeting takes place around 2:30. I have. There's a need to fulfill 2 more positions. The Board of Health Finance Committee. That way we can maintain a quorum. I need to appoint 2 more members of that Board of Health Finance Committee. Is there anybody that has interest in maybe being on that board? The term is for, I'm looking here, I think it's a 2-year. No, can anybody help me with how long that term would last? Vera, or how long is this? That term is your 4-year terms is what I'm saying here. I believe it's a 4-year term for just the members. Somebody that's either interested in serving or somebody that has a recommendation of who would be good to serve for me to be able to consider and appoint.
Well, Mr. Chairman, this is Don Casano. I believe I'm still on the Finance Committee. If that
you are, that's what I showed.
Yeah. Okay, then I would be continuing to serve. Thank you.
Yeah, thank you.
Yeah,
thank you, Don.
I think this, Dr. Stander, I think same there, just to confirm that you have me listed.
Okay, good. Do we have Dr. Stander right now, Vera, on that list? I didn't see him on there.
Because I had agreed to. Okay, I had agreed. Yeah, and I think I've actually been getting, the information. So I'm happy to do that.
Okay, so Dr. Stander, you're another one. We need 1 more appointment then to the Board of Health Finance Committee. Is there anybody that either would like would actually like to serve, or do you have anybody have a who would be good to serve? If not, I'd like to see if I could appoint somebody and see if they'll do it for us.
Mr. President, Scott Seeley again. It was also my understanding that I'm a member of the Finance Committee.
You are. Yes, that's
Okay.
right. You're the vice president of you're the vice president. You look at the title here. It's
So in which
vice
case,
president.
wouldn't
You serve as the chair. You serve as the chairman, I believe, during those meetings. I believe.
great.
Scott.
So it wouldn't
Yeah.
do any good for me to volunteer then. So,
Yeah, that's right.
thank
We
you.
have right now. We have Don. We have yourself. We have Dr. Stander, and we need one more. Paula, would you mind serving on that board?
You know, I hate to tell you, but that is the weakest skill I have, which is why I hired a very smart CFO here.
Okay. Yeah, gotcha. Robin, how about yourself?
Well, I'm a year in now, I might as well just throw my name in the hat. You know,
Okay.
dealt with large budgets in my past job, so let's do it.
Okay, great. Thank you, Robin. Thank you for doing that. So I'd like to appoint Robin additionally to the Board of Health Finance Committee. And I think that gives us the additional two. So right now I have on the list Don Casano. I've got Dr. Stander. I've got Vice President Seeley. And now I've got Robin, right? So that I think that completes all the positions we have. Does that sound right to you, Vera, that we've got all the people we need at this point? I think you're on mute.
Can you hear us now?
Can you guys hear us now?
Yes.
I can hear you, yes.
Yes, we can.
So would that put us in a full number of positions that we need to have to be serving on the board? I believe it would. I'm counting.
Okay, if you can hear us, I'll go ahead and speak. We're having audio problems. I apologize. Yes,
no
I did hear you. Yes, you have two members to appoint to the Maricopa County Board of Health Finance Committee. I heard the two members of interest. Dr. Stander was one. Can you please tell me who was the second member?
Robin Schaefer.
Thank you very much. Mr. President, would you like me to read the bylaws? You asked about the terms, but you weren't able to hear me recite it.
That's
for
right.
Article 5 underneath officers.
Yes, will you please do that for us?
Sir? Are we okay?
Yes, ma'am. Will you please do that? Mm-hmm.
Sure. Section 3 reads, the term of the President and Vice President Finance shall be for 2 years. Both officers may serve an additional 1-year term immediately following their initial 2-year term upon the approval of the board. Individual members are limited to serving a 3-year maximum term as an officer during any 4-year term of appointment to the Board of Health. End of section 3.
Thank you for that, Clary. So that position would be for 3 years then, at this point. Okay.
2-year term.
Two
It can go
years.
to a max. Yes. 2-year term.
Did you say it's a 2-year term? Thank you.
Thank you.
Okay. So does that complete I'd like to appoint those two positions, Robin Schaefer and Dr. Stander, and in addition to the 3 members, which would be Don Casano, myself, and Scott Seeley. Okay.
That's
the
correct.
next item. The next item on the list is the public health, the third quarter fiscal 21 status report. Could we get Mr. Picarian? Could you please take the floor here and present that to us? Mm-hmm.
I apologize. President McMillan?
Yes.
Members of the board, excuse me. I believe the request from the Board of Health members was to have Director Flanagan present the public health report before we went to finance. Is that still okay?
Okay. Yes. Yes, that wouldn't be a problem at all. I didn't see it in that order on the agenda, although we did talk about it, but that would be fine.
Thank you. Marcy, is that okay with you?
Sure, that's okay with me.
Marcy, would you
Thank you.
please take the floor then?
Sure. I am going to give a quick update on numbers of where we are nationally and then where we are here in Maricopa County, and then give a status update on where we are with vaccines and herd immunity and some of the probably news you've heard about the various vaccines lately in the community. So nationally, cases in the US, we have 31,666,546. This was as of today. The case rate, the 7-day case rate per 100,000 nationally is 132. And deaths that we've seen nationally are 566,494. The case rate for the US today increased by just over 62,000 new cases, and there were 875 new deaths today.
Marcy, excuse me. We're not seeing that. Are you reading from a document right now? We're just seeing the agenda right now.
Yeah, I'm just reading from a document.
Okay, and are we supposed to be seeing that and following along right now?
No, I just have it to.
Okay, I got you. Okay, Marcy, thank you.
You're welcome. For Maricopa County, our case rate per 100,000, if you remember, I said it was 132 nationally. Our case rate here in Maricopa County is 78 cases per 100,000. So as you see, we're a little bit lower than the national average. That was for our most previous week case count. That was April the 11th through April 17th. It has gone up slightly the week prior. We were at 67 per 100,000. So our case rate increased slightly over the past 2 weeks. Our positive cases, we're seeing about 6% PCR positive cases in Maricopa County. When we talk about vaccines, we've had over 2.5 million residents in Maricopa County that have been vaccinated, and 1.1 million or 25% of Maricopa County's residents have been fully vaccinated. So we are creeping up on that number of reaching herd immunity, and about 80% of adults 65 and older have received at least one dose of a vaccine. We are averaging about 30,000 vaccines a day in Maricopa County. That includes the vaccines that are administered through local public health and the state pods that are here in Maricopa County. We are still seeing a higher incident of ethnic minorities of receiving the vaccine, but we have a lot of programs in place that we're working on with our local community partners to get in and really get these residents vaccinated in these hard to reach and minority populations. When we talk about herd immunity, there's been a lot of reports. There's still not a definitive percentage that we have to get to reach herd immunity for COVID-19. A lot of reports are saying between 80 and 90%. So when you think about the percent of residents that have been vaccinated and us getting to about that 80, 85% for herd immunity, and you give that, combine that with the folks that have already been infected, we still have a little ways to go. And we know that the vaccine interest, not only nationally, but we've seen it locally, has started to decline. We've had a higher rate of no-show appointments or individuals not coming back even for their second dose. And so there is a big campaign the county is working on, our communications department. There's also communications happening at the state level and the national level about vaccine and how important it is to get your vaccine for COVID-19. So you're going to see a lot of this because nationally, there's even shared from the CDC in a call this morning. They have several states that have actually turned down receiving their full allotment of vaccine because they've seen their numbers of interest decline, and they wanted to go to states where there's still a lot of interest. So in Arizona, we've seen the same thing. Some of the smaller counties have turned down their full allocation from the state, and we've been able to see an increase in our allocation here in Maricopa County. The Johnson & Johnson vaccine, you know that there was currently a pause in place as the FDA and CDC evaluated the cases of a rare side effect of blood clots in individuals that received the vaccine. There was an ACIP meeting on Friday to review the additional information and the case studies. The decision was made Friday evening to resume the use of Johnson & Johnson vaccine. They did update a new information sheet that is going to be provided to everyone that receives the Johnson & Johnson vaccine. This still is very rare and the chances are very low. And the CDC, along with FDA and ACIP, are working on a case definition that'll help us further identify any potential cases. We communicated with our partners Friday evening that they could begin reusing the Johnson & Johnson vaccine. We had several partners that had Johnson & Johnson vaccine on hand. And so all of those partners are going to resume using the Johnson & Johnson vaccine this week. And when we start to look at the different variants in the US, all of the variants so far that we've seen in Arizona, there haven't been any new variants identified. The most common variant of all cases in the world is still the B117 lineage. That's 44% of cases we're seeing with that. In California, they have started seeing a much larger number of the B1429 variant. That's about 7% of all cases in California. Here in Arizona, we're still seeing that top B117 as most of the cases here in Arizona. And also when we talk about what our goal is moving forward in this response for Maricopa County, it's really is to bring the vaccine to groups who have a hard time making or getting to a vaccine appointment. This includes folks with mobility restrictions, vulnerable communities, and vulnerable businesses. So businesses with economic, cultural, or language disadvantages. We do maintain a list of residents to let them know when there is additional appointments that have not been appointments, no-shows, or availability. And that is on our website. I can share that with the board in the meeting minutes of where individuals can go to be added to this list. This lets the residents know when an event is coming open near them and how they can register or get signed up for that. We also have a list of for homebound individuals where they can get on a list, and we will actually do home visits. For those, we have been using the Johnson & Johnson vaccine because it's just a lot easier for homebound individuals to go in one time and provide the vaccine. That was on pause while the Johnson & Johnson was on pause, but vaccinating homebound individuals resumed again starting today. We have also been working hard to vaccinate group homes and behavioral health homes with some of our contractors. We are continuing to do outreach to farms and field workers who work at those farms. That's a partnership with the University of Arizona. They actually travel out to the farms and hold vaccine events. They were initially using Johnson & Johnson. When Johnson & Johnson went on pause, we continued doing those events with Moderna. So they'll have to go back to the farms where they used Moderna to do second doses. But moving forward, they're going to try to continue to use Johnson & Johnson. That's really what those field workers have requested, is just to use the one-dose vaccine. We also have kind of these pop-up or mini pods that we're having with our refugee communities. There have been highly successful events in the Islamic community. We had one in the Asian Pacific Islander community over the weekend that was also a huge success. So we've seen really when we work with the right partners in these communities that have relationships built and they are trusted among those communities, that we have really good turnout, which is exciting. We are also partnering with the Arizona Partnership for Immunization for in-person and virtual talks about vaccine hesitancy and data for making decisions about vaccine and receiving a vaccine. There's a group of volunteers who will talk about the vaccine, what to expect, how to get an appointment, addressing concerns on a personal level. And all of that information will be available on a website that is www.whyimmunize.org. Again, we can put these in the meeting minutes. That website is supposed to go live this week. And outside of that, we are still continuing to take calls in our call centers from individuals that need help with appointments or questions related to testing. And those are all of my updates, and I'll take any questions you all have.
Thank you, Marcy. Is there anybody that has questions for Marcy from the board?
It's not a question for Marcy. It's Robin Schaefer. Again, I'm going to thank you, Marcy, for doing such a fantastic job. I'm also on the distribution list for volunteer lists, and I see how many emails go out a day to ask volunteers to work at these sites. And I just want to say thank you for such great coordination and outreach in every single aspect of this pandemic and now the vaccine. So thank you.
Thank you so much, Robin. I look forward to when we get to start to wind down our efforts is having some of the team come and present all the numbers of what we've seen, especially from our volunteers, the thousands of hours, the number of volunteers, all the actual data, and sort of like a end of pandemic report. I think this board will find very interesting.
Didn't Maricopa just receive an award for that program or acknowledgement? I saw something come across.
Our the Medical Reserve Board did receive national recognition for the work that they've done in the volunteers, and they were also honorable mention in 5 different categories.
One of which is one of our nurses, Alicia. So thank you.
Marcy, this is Dr. Stander. 2 quick questions. One, are you talking about outreach to the minority communities or rural communities for vaccine? What about the receptivity and outreach among some of the younger people who seem to be the higher caseloads now, and then who may be continuing to transmit it? If whether the colleges or universities are going to mandate vaccine, to return to in-person learning. Can you update us on that?
Sure, Dr. Stander, members of the board. That's a great question, and a very accurate observation that it's the younger folks that, especially when we were seeing some of those high numbers throughout the outbreak and certain peaks of the outbreak, was those younger age groups that were really the ones having more and more increase in case counts. I know both of the large universities, state universities, ASU and U of A, both have campaigns that they are running within their schools to increase awareness and access to vaccines. Both of them have clinics set up on campus where they're encouraging students to get vaccinated. I haven't heard anything or seen anything that they're going to require vaccination to go back to in-person learning, but I can tell you they're doing a huge push to get those folks vaccinated. I think that our team has started coming up with different ideas of how we can set up clinics in different areas or pop-up events in areas where these younger folks tend to hang out and go. And we're in the works of getting some of that in the coming months out there.
Okay, thanks. And then The other question I was going to ask you, I mean, I think we're all aware that the governor rescinded the statewide mask mandate a while back. Can you just give us a sense of, what's the status in Maricopa County among most businesses, and/or does the county have a formal stance on mask usage, or is it city by city? Can you just update us on that?
Absolutely. So when the governor did rescind the mask mandate, it also put into place that no jurisdiction, city, town, county could have a mandate in place. Pima County and I believe the city of Tucson continue to keep their mask mandate in place. I don't know where that stands legally right now. That kind of, disagreement on that. For us, we've heard a lot of businesses are continuing to require masks from the public, which they're absolutely allowed to do as a business. The most recent action was when the initial rescinding the mask mandate happened, it still did require masks in schools. Just about a week and a half ago, that was actually rescinded as well. So masks are now optional at school districts. We've seen really a mixed bag. We've seen some school districts continue to require masks of all their students, guests, faculty at those schools, but we've also heard of some schools that are no longer requiring masks and just making it optional. We're working closely with the Arizona Department of Education because we've started receiving calls, and so have they, that some of the students wearing a mask is now just optional, that if they do choose to wear a mask, there's been some bullying and some criticism for the students that choose to wear a mask. So we've had parents call with concerns. So we're working with ADE and how we can get out information to the schools that they really need to be aware of this and, talk to their students about the importance of personal choice and responsibility. Our stance on the masks is that from a public health standpoint, they are still one of the best mitigation tools that individuals can use. And we still encourage everyone, as long as we're in a pandemic, to wear a mask when you're out in public, especially in circumstances or situations where you cannot socially distance. And that's it's still the recommendation of the CDC. So our official statement is pretty much copy and pasted from the CDC on their recommendation. And that's what we've been sharing with any schools or businesses that reach out that asks us if we still recommend that the public wear face masks. But as far as Maricopa County having a face mask mandate in place, there's no longer a mandate in place from Maricopa County.
And
Got it.
Dr.
Thank
Standard, this is Bill Gates. If I could just add to that, agree with everything that Marcy said. One, just as a reminder, there was never a statewide mask mandate, but for a number of months, the governor did allow cities and counties to adopt mask mandates. Within 48 hours of him allowing that, of course, we voted to put a mask mandate in place. We believed when he issued the executive order saying that we could no longer have these mask mandates, we believe that effectively ended our mask mandate. So the county board of supervisors never voted to get rid of it. We just felt that it ended as operation of law. But I will add as well that we continue to require masks in all county buildings at this point. And so that's the status of that. Marcy, if I could just add one other thing, thank you for your presentation. And I wanted you to know that I was at an event today with the city of Phoenix where we were doing, thank you very much for doing this, pop-up vaccination pod at Sky Harbor Airport. And so all the folks there at Sky Harbor, employees, are going to get vaccinated. Dr. Bob was there, and he wanted me to pass on his respect and great appreciation for the work that you and your team have done over the years. So I know there are some people on the Board of Health who know Dr. Bob well, who remember Dr. Bob, but he sends his best to everyone. Thank you, Mr. President.
Of course. Anyone else that has questions for Marcy?
Mr. President, Scott Seeley, and I would, Marcy, just, I don't know if pile on or affirm, both the supervisor's observations, but also, I believe it was Robin earlier, for the great job the team is doing in so many different areas. And I was on the university front at a, I was on the GCU campus, Grand Canyon University campus this morning, and I was surprised at how robust the turnout was for their vaccination. They had quite a backup there and looked like pretty high demand at their vaccination location. One of the I guess it's a question about what not necessarily we've seen, but what might be best in class opportunity around the country. I mean, there's obviously been reaction and some rebellion or whatever you want to call it, against the vaccine passport kind of mandated approach. But and this is in my own experience in the healthcare field, usually mandating things doesn't go over well, but incentivizing things can have great results. And I was interested even in the supervisor's observations about this too. But what I've wondered is whether we don't have an opportunity, or there has been discussion about how we could make it attractive to people to have the vaccine, and things like Arizona Diamondbacks having a half price ticket event or something, or other venues in the county where it would be attractive to people to be able to prove that they were vaccinated. And I imagine there are some places where there's pushback against that, and people say it's not fair or whatever it is. But in my experience, you get a lot more results with sugar than you do with salt or whatever that maxim is. Is there anybody around the country who is making it appealing to people, making it even profitable for people if they are vaccinated? Does that make sense?
Well, this is Paul Standard. Go ahead. Marcy, I'm just going to comment as Paul Standard. I agree that in general, sugar rather than salt or whatever, incentivizing rather than, making mandates generally is a favorable thing. I think at this point, from what I can gather, most of the people now who are not willing are sort of but for lack of a better term, have fallen prey to the misinformation, conspiracy, it's going to destroy your DNA and, or it's a government plot or whatever. I don't think that those people are as prone to be incentivized by anything, because they are just believe that, they don't need it, or their body's strong, or vaccines are bad. So I don't think anywhere around the country anybody has tried that approach. It's been more of trying to offset the misinformation and the, whatever you want to call it, that is somehow people view it as some kind of freedom issue, liberty issue, anti-government issue. That's my own view. But Marcy, I don't know, maybe you know some other places where they have tried that.
So what I do know is that there's been a lot of studies on whether offering certain incentives would motivate individuals to get vaccinated. The studies that came back, it said there was a slight percentage of individuals that would get vaccinated for monetary compensation. Usually the other non-monetary incentives were not that highly regarded from individuals who were hesitant to receive a vaccine. But I think that absolutely the majority, when we get down to it, individuals who want to get vaccinated are going to, and those that don't. It's just going to be talking to trusted individuals within their community, or whether that it comes from their faith-based community, family members, friends, neighbors who have confidence in the vaccine. And it's really just doing that education. But I'm certainly not opposed to exploring different options. I don't know. Supervisor Gates might have a better idea on this, on where the county would stand in incentivizing individuals. But at this point, we still know we have a lot of folks that want to get vaccinated, and that we can get vaccine to a location that is easy for them to receive their vaccine. And so I think the next couple months anyway, we still have a large number of individuals that are ready and willing to get the vaccine. It's just getting it to them.
Well, that's great. And as I said, again, this morning I saw, and this is Scott again, I did see, some very robust interest in getting vaccinated this morning. But I would just say, I mean, if I heard you correctly earlier, where we find the least interest is among younger people who see themselves as invincible. They're less likely to feel like they need to get vaccinated because nothing bad happens to them, even if they get it, if they get COVID. But that's also, in my experience, the audience that is more likely to show up for something if you offer them a free pizza or a free sub. And so if we're trying to prevent those super spreader young people who are not showing up for vaccinations, I think it's worth talking to, whether it's a pizza provider, somebody who either in Tempe or Tucson or near campuses that do these sorts of promotions regularly, at the possibility as good citizens that they would want to sign up and partner with Maricopa Public Health and show up for your one-shot vaccination and get a free pizza as you leave the door, in targeted places with target audiences that historically have been shown they'll do anything you ask them to for free food. So that's just a thought.
Okay, thank you. Anybody else have comments or questions for Marcy?
Hi, this is Paula. The only thing that I would add to that, because I completely agree, is, to really explain and educate the unknown of how each person is going to react to actually getting the COVID virus. Yes, while these young folks think that they're pretty invincible, we need to encourage that, there have been 18-year-olds that have passed away, that there's a genetic component to this virus, and it's important for them to realize that they have no idea how they're going to react if they ever do get it. So I think that's just one more important factor. Thank you.
Thank you. Marcy, I just have a question. Is there any more information of how long the vaccines will effectively last? Because the long play here is, what are we going to do in a year or 2 years from now? Is there any more information on that? I know that there hasn't been a lot in the past, but has anything else developed on the how long these vaccines will last before they have to be given again?
So the latest research right now is leaning towards there's probably going to be a required booster. There hasn't been any definitive data published that I've seen that's beyond. They know they're effective at that same level of, for the Pfizer and Moderna, around the 95% for 90 days. But they're, as time goes on from when individuals were first vaccinated and where we're at now in their potential exposures, that is increasing. But the latest data I've seen is still with confidence is 90 days. But certainly they are, I have heard reports in the medical community from CDC webinars I've been on that there is a belief there will be a COVID-19 booster.
Thank you. Anyone else with comments or questions of Marcy?
Marcy, just another question based on what you just said. Would a booster just be the same shot again, or is it going to be reformulated?
So we don't know any of that. It's just medical sort of speculation that there'll be a booster. But typically with a booster, they would reformulate it slightly to try to be more effective on any new variants that have popped up. And what I've heard is that the booster would be a year after your initial vaccine.
So they're hoping that the initial vaccine will last a year. Is that what you're saying? Okay. So I shouldn't rush out and get a third shot, right? Thank you. Not yet.
Mr. President, Marcy, Scott Seeley again, just to refer back, and I think you might have heard earlier, Paula and Robin both had talked about some of the other public health issues that an annual report might surface as well. So as you said, you're at least thinking about COVID winding up at some point along the way. Are there other things that you are keeping an eye on that you're seeing that are either concerning or areas of focus for the department in public health that are not COVID-19?
So certainly I think at a future meeting we can go over some of those. But, we're doing a lot of data collection on health status of the community and what has changed since COVID-19. What we know just from data from the medical examiner's office and from state data is that there has been an increase in some overdose deaths, whether that is or is not related or how it's related to COVID is something our team is exploring. We've also seen increases in sexually transmitted diseases. And so all of those are issues, even beyond the health equity that we really are focusing on in our department, of some areas that we are taking a close look at.
Great, thank you.
Thank you again, Marcy. Is there anyone else that has comments or questions of Marcy? Okay, Marcy, thank you for that report, and thank you for all that you and your group Public Health does. It's certainly been I'm sure a time when everybody in their career of public health will look back. It'll be the highlight of their career probably. So thank you for all that your group's done to maintain public health for Maricopa County. I mean, it's been what a ride it's been the last year. So if we're done, Marcy, is there anything else you have to add or to comment on?
I don't have anything else. Thank you for the board for your support and all your compliments. I'll certainly share it with the team.
Thank you. Okay, so the next item on the agenda is public health.
President McMillan, I'm sorry to interrupt. This is Ann Longo.
Sure.
Just a quick housekeeping item. I wanted to go back to number 4. I don't see that there was a motion to approve the 2 new appointments to the Finance Committee. So if you could do that, I think that would just tie that up before we move on.
Sure, that would be fine. Just for my own clarification, does that need a motion, or is that an appointment, or are we playing it safe here? Just.
I think playing it safe. It is an action item. You did make an appointment, so I think it's best that the board move to approve the appointment.
Will do. Gotcha. Thank you, Ann. Okay, so could I have a motion to approve the additional 2 board members, which were Robin Schaefer and Dr. Paul Stander? Could I have a motion? Do I have a motion to approve that?
Mr. Chairman, this is Don Casano. I would make a motion to approve Robin Schaefer and Dr. Paul Stander to the Finance Committee.
Thank you. Do I have a second?
Scott Seeley, second.
Go ahead.
I'm sorry. There are 2 of you talking at one time. Could one of you go ahead?
Deborah Baldoff, I second.
Thank you, Deborah. We have, can we please, all in favor of Robin Schaefer and Dr. Stander being added to the Finance Committee? All those in favor say aye, please.
Aye.
Those opposed say nay. Motion carries. Thank you, Ms. Longo, for cleaning that up for us. Okay, so the next item on the agenda would be item 5, public health. We're going to, Mr. Picarian's going to give us the third quarter fiscal year 21 status report.
Yes, Mr. President and members of the board, through March, or 75% of the fiscal year for the general fund, we've expended 66% of the general fund budget. This is a positive variance year to date of $945,000. We do have a higher than usual number of vacancies right now, but it really is the reallocation of payroll to the CARES Act funding that's made the biggest difference. That's for staff, general fund staff, who have been working on the response, and their time spent on that is allocated over to the CARES Act. So that's been a large budget impact for us, resulting in a large positive variance. In the services category, there's actually a negative variance of $438,000 year to date. This is in part the result of the funeral home services for the SIDS program, the Community Indigent Decedents Services Program, running ahead of original budget. Any questions about the general fund before I move on to the Fund 200?
Does anybody have any questions on that?
I do not.
No.
No.
Okay.
All right.
Thank you, Scott.
Fund 200, the Coronavirus Relief Fund, CARES Act funding. This is the main fund for the COVID-19 response, CARES Act. Since July, most of this fund's activity has gone through the department D890, the UCC, which is a separate department from us that was created to administer those funds. Some of the costs are remaining in our department D860, however. The CARES Act funds have been extended through December 31st, but the new department D890 will be ceasing operations by the end of June, and the funding, the spending of that funding is anticipated to cease at that time as well. The Office of Vital Registration has been fully funded through the fee fund until recently. However, they took on the function recently of the SIDS program that I mentioned earlier, the County Indigent Decedent Services Program, which had previously been provided by the Public Fiduciary Department. And for the next few months, a share of the staffing and contracted services for this program will be paid from Fund 200, the CARES Act, as I said, up through the month of June. For the current year, Vital Registration received $476,000 in general fund funding, and this amount will be increasing in FY22 if the Budget Office's recommendation and our request is approved by the Board of Supervisors, which is highly likely. Before I move on to Fund 265, any questions on the Fund 200? All right, for Fund 265, our
sorry, Scott, I'm
yes.
sorry, it's Scott Seeley. And I guess this is maybe a prospective question, but so the department is still spending money from the CARES Act, which was a year ago, and it looks like been extended for a year, so it's going to go through the end of 2021. As I understand it, the latest, the American Recovery Act passed in January, I guess, which has a rather large amount of money in it. In general, is there money included in that, I assume, for public health purposes? And if so, are there is there planning underway about what the department might do with those funds that appear to be on top of what are already extra dollars that we're spending before or until the end of the year?
This is Max. What the department is, when they say that the CARES Act funding has been extended until December 30th, what that means is the funding can be closed out through December 30th. They expect all funds to be expended by June 30th. It's just that the fund itself will not be closed out accounting-wise until the end of the year. With the new act, the recovery dollars that are coming in through ARPA, while a lot of the dollars have already been added to the county, we are working with that with our next year's budget. And with that, I can turn it over to the Assistant County Manager, Leanne Bowen, is on the call also, and she can answer as far as the future dollars go. Leanne, can you unmute?
Yes.
Okay.
Yes. Good afternoon. Can you hear me?
Yes.
Yes.
Yep.
Good afternoon, Chairman and members of the board. So yeah, as Max explained, our CARES Act funding, we have until the end of this calendar year to spend it. Our intention is to have that fully spent by the end of June. We have prioritized, of course, the pandemic response with those funds. The new American Rescue Plan Act funds, the county is slated to receive a total of about $870 million. It's a lot of money. The first half will come sometime in the next 2 weeks. We are still awaiting federal guidance, though, on how those funds can be spent. And as we learned with the CARES Act funding, the devil is sometimes in the details about what we can and cannot use those funds for. So in addition to those funds coming to the county that can be used for a variety of things, not just pandemic or public health related, but also things more on the human services and even on business assistance lines as well. The state of Arizona is receiving a lot of ARPA money as well. So $4.8 billion to the state. That's very similar to our $870 million. But then several $100 million in funds that are dedicated specifically to things like vaccine and contact tracing and other public health specific programs. And we do expect that some of those funds will flow down to the county public health agencies. We don't know how much or when, but we do expect over the next several months there to be a large number of grant dollars coming through to the county. And as we find out more about that and find out guidance on that from the federal government, we can certainly share it.
Great, thanks, Leanne. Well, and Leanne, we have chatted a little bit about the whole array of things that the funding might be able to help with. I really was just kind of curious if we've got any specific public health initiatives that if we were to get the money, we might be able to do some things, and maybe that might be a nice tie up with the health report, looking at where we have needs and so forth. But I was just curious whether the public health department had some health initiatives that were kind of queued up that if the funding came through, we might be able to launch them. So we'll, I guess, stay tuned.
Yes, I think the short answer to that is yes, absolutely. And that the varied funding sources, I think public health is going to have a lot of opportunities in terms of funding to put a lot of programs into place in the coming year.
Great, thank you.
Scott, back to you.
Yes, okay, continuing on with Fund 265, our Special Revenue Fund. Through the 3/4 of the year, we spent 67% of our expenditure budget, and actual expenditures year to date are under budget by $722,000. However, when the one-time non-recurring budget is netted out, we actually spent all but $33,000 of the regular operating budget to date. So we're much closer to budget in our operating spending. A big factor resulting in the small positive variance is the large amount of purchases of flu vaccine we made early in the year as a dry run for the administration of the COVID vaccine. Fund 532, the grant fund. Through the Q3, the grant fund revenues are $13.1 million or 28% below budget. Expenditures are $10 million or 23% under budget year to date. Revenue to expense, the whole fund account is $870,000 short of being structurally balanced. In other words, revenue matching expenditures. As we have pointed out before, all of our grants do bring in enough revenue to match expenditures before they can be closed out. These numbers, however, do point out the substantial impact that COVID-19 has had on some grant operations. Our WIC grant has been able to keep up with clients by working remotely, as have our Ryan White programs, but a few grants, such as oral health and dental sealant grants, depend on schools being open and have been hit hard. And just to put it in perspective, if we receive anywhere from 60 to 100 and some million dollars of additional funding at public health, that would more than double our current budget across all funds. And that's the end of this report. Any questions?
Any report, any questions or comments from the board?
No, I have none. This is Paula.
Okay, Scott, you on?
Okay. Next agenda item would be the review and approval of the budget which we requested and subsequently recommended by the county budget office. And if you can see the handout there, excuse me, let me just read off this. We would like to make a recommendation to the Board of Supervisors to approve the Public Health FY22 budget request as recommended by the County Budget Office. So the one-page sheet that is up on the screen for you, you can see there are 3 number columns there, plus a variance and percent column right after that. And it's broken out by Fund 100, Fund 265, and Fund 532, our grant fund. The first number column, the adopted budget for current year, that's what would have been passed by the board last June, Board of Supervisors. And then the FY21 revised budget, the second column, includes any adjustments that have been made during the current year. And then the third column there is the recommended budget. That is, for the most part, what we requested has been recommended by the budget office, which is then proposed to the board. And we don't anticipate that there will be changes as it goes to final approval, but of course it's not done until it's done. And so you can see that we went up substantially from FY21 revised budget up to the FY22 recommended budget, and that is primarily because we submitted an above baseline request for about $3 million, which the budget office has reviewed and recommended. And we'll go through a little more detail on that in a moment. Then if you go to the Fund 265, you can see that there's been just a minor increase in base adjustments in the operating budget. In the non-recurring budget, it started out last year at $500,000, then it bumped up to $1.1 million. That included $650,000 for the new Peoria office improvements. And then now it's in our recommended budget, it's $687,000, so $187,000 over the original $500,000 from last year. And then in the grant fund, you can see that we're showing increases of 18.8% from what was adopted last year, and that includes some of the additional COVID-related funding that has come on board, such as for immunization, but not some of the other pending funding that was discussed by Leanne and others. So now if we go to the section down below, that gets into some of the detail of what makes up the budget variances, the budget changes. So for the general fund, we had a couple $100,000 of baseline adjustments, and then just below that, you can see a breakout of the above baseline requests that I mentioned before, totaling up to the $3 million. And so that included clinical services expansion for $314,000, community health and wellness promotion, Oh, and by the way, to the right, it indicates the number of positions that have been approved for each one of these initiatives. So 3 for clinical services expansion, 3 for community health and wellness promotion, and 4 for supplemental administration, which includes 3 regional community liaisons positions that we had requested and have been recommended. The indigent decedent program that I mentioned previously, this funding is to meet the needs of what we now are seeing is needed for this program, and also to replace some of the CARES Act funding that will be ending at the end of this year. $489,000 for the child immunization program, and about $800,000 in 9 positions for epidemiology program. And some of these needs have become more obvious in the past year, especially with trying to respond to the pandemic. Then we move on.
Scott,
any questions about general fund? Yes, go ahead.
I'm sorry, Mr. President. Scott, your prior memo concluded, I think you said something anticipating somewhere in the range of $60 to $100 million. Was that in additional dollars coming on top of the $60 million for this last year?
Yes. Yeah, it would be additional. Well, there's a part of it. We received an immunization grant, for example, just recently for $10 million above that, but there's still a lot that's pending out there that could be increase our double our budget basically, or more.
I guess I would just offer to my colleagues that, I mean, that is a lot of opportunity to positively impact public health. If it's correct that that's additional dollars beyond the core public health program. Is that what you're saying, Scott?
Yes, that's correct.
Okay. So that's why to the extent we can think big about positive public health impact going forward, it's extraordinary the amount of money that might be available and what our team might be able to do with it to come out of this improving public health somehow. So,
Mr. Seeley, members of the board, this is Max. While there is a large amount of money coming in with grant dollars, what Scott is explaining to you right now are additions to our baseline general fund. So that will be ongoing dollars year after year. A lot of these things will not be truly expended during this next fiscal year, as a lot of these funds will probably be expended through the grant dollars that are coming into the department. And some of these positions that are listed there with our above baseline request are already established in our department through the CARES Act funding, but this funding that we are requesting from the board and that the Department of the Budget Office has recommended to the board, and we're asking for your recommendation, are keeping those positions in an ongoing basis. And so as Scott explains this above baseline request to you, these are ongoing. So while they might not be expended this year because we have the additional funding coming in through grants, the importance of this is it is ongoing beyond those grant dollars. Just as long as you can note that in your recommendation.
Thank you, Max. Any questions?
Okay. Fund 265. We had 100,000 and a little more in base adjustments and for the recommendation, and then there's some non-recurring adjustments. The funding for the Northwest Valley office that was just completed is being completed this year, and there'll be a grand opening soon for that. 650,000, which was put in, and then we take that amount out, and the rest that was added in since it's one-time funding, and then we add back in $687,000, and 600,000 of that was for the new Glendale office, which we have an office in Glendale for WIC, a smaller building, and now there's a larger building that's being made available to us. Of course, there'll need to be a substantial amount of improvements made to it in the process. For the grant fund, there's $10.2 million of new funding that's been included in the budget. That's what's already been approved, COVID related, above what was in the base. Then you have removal of some of that COVID related grant adjustment of $8.5 million, and then various grant adjustments to add $7.2 million. So you can see it's an ebb and flow of what has been given and then what ends and what is then added back in other grants. And then there's some carryover adjustments of $752,000 that was budgeted to spend this year. We don't anticipate spending that because of all the focus on COVID. But then for next year, we've requested $457,000 of leftover funding from several of our grants to be spent during FY22. And that's all that I have. Any questions?
It's Robin Schaefer, Mr. Chairman. I don't have a question. I just want to say how pleased I was in the general fund with those above baseline requests for the different positions, because I know that the whole staff has been stressed and challenged during this pandemic, and you know what you can do with those programs and the additional positions would just be amazing. So I'm glad to see, even though it's more money, it's needed.
Thank you. Any other questions or comments? Scott, I've got a question. Just you know, the general funds, how there would be a permanent increase. You know, just the underlying reason, additional position. Is it related, or is it really just improving health?
Related to COVID, Mr. President, or?
Sorry, you broke up during that last piece on your question.
Oh, sure. The general fund increase in general fund, it's a significant increase. Is for the increases, is that due to mainly, is that because of the effects of COVID in terms of the effects that would have on public health? But really not COVID related increases, and really just excluding whether we even have an epidemic, that these increases would still be needed. Can you clarify that for me?
Yes,
that's correct.
That's correct. What the pandemic has done is expose some deficiencies that our department has been working with for quite a while, and it's also exposed the benefit that can come by having these positions there. So while we all hope that this pandemic quickly leaves, the addition of these positions will help with the public health messaging and also the true public health of the public for years to come. Each of these positions are in different areas. I don't know if you can read it on your screen or if you can look in your handouts, but these are for specific positions, either in disease control or in clinical services or in different areas that will have a lasting effect on the public health for years to come for our county.
Thank you. Any questions or comments from the board? So do I have for recommendation of the supervisors for approved public health fiscal budget as recommended by the budget office?
It's Robin Schaefer. I make a motion to approve the budget before us. And Well, was there anything else to that?
No, do I have a second?
Mr. Chairman, it's
on
Don Casano. I will second that motion.
Thank you, Don.
Mhm.
Okay, can we have a vote then? All in favor of recommending to the Board of Supervisors for approval of the Public Health Fiscal 2022 budget?
Mr. President, before you take that vote,
Yes.
this is Max. What you're doing is making a recommendation to the Board of Supervisors that they adopt this new budget. This is an action that's required by statute that we have to do every year, where the Board of Health recommends to the Board of Supervisors the adoption of this proposed budget. Okay, so as long as you understand that with your vote.
Thank you.
And Max,
hopefully
we're to understand
Go
that
ahead.
it's been cleared with the budget office, correct? So we're not getting crosswise with it.
Yes, that is correct. The budget office has vetted it and has recommended it, but by statute, it requires that this board take action and recommend it to the board itself.
Okay, so Robin, should I make a different motion then to recommend that this budget move forward to the Board of Supervisors for approval?
Mr. Chairman, I will second the revision.
Okay,
Original motion.
Thank you, Don. I have a vote, please, on a recommendation of our board's recommendation to recommend to the Board of Supervisors approval of the Public Health Fiscal 20 budget as recommended. Could I get a vote by all those? Aye.
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 Those opposed, say nay. Okay, the motion carries. Thank you for your presentation today and all the work you do for us. Thank you, Scott. Next on the agenda is item 6, vehicle service. How would you please present the third quarter fiscal 21 report?
Thank you, Mr. President and members of the board. Yes, this is Ryan Hautzinger, and good to be here for the second presentation. I'll follow a similar format to Scott. I'll go through pretty briefly, briefer than I did in quarter 2, an update to be conscious of your time here for quarter 3, and then do a little bit more in depth for our fiscal year 2022 budget request summary. And I'll leave some room for questions here. So with our Fund 100, our county general fund, it's reporting revenues 90% or $209,000 over the year-to-date budget, and expenditures 8% or $763,000. And this should read under, that's why it's in green, the year-to-date budget, just a little typo there, from period 9 close in fiscal year 2021. And these variance rates for Fund 100 have remained nearly identical to our quarter 2 Fund 100 expenditures, but in quarter 3, the variance for expenditures should increase as end of year purchases are made. With the tire fund, Fund 290, it's reporting revenues 6% or $293,000 under the year-to-date budget, and expenditures 13% or $553,000 under the year-to-date budget through period 9 close in fiscal year 2021. And so, as I discussed in quarter 2, lower than normal tire disposal tax revenues continue to be distributed to us by the state. And expenditures, they've flipped from negative to positive variance due to the department. We absorbed $850,000 into our fund balance in a non-recurring appropriation that was recently approved by the County Board of Supervisors. I talked about this in quarter 2 that we were proposing to do this in the interim. This has happened, and now this has diminished our fund balance to $2.3 million. And this is still plenty to keep us afloat, even if we had no revenue for several years still. We don't anticipate that happening, obviously, but it is good to have this emergency backup. For Fund 506, our fee fund, It's reporting revenues 2% or $323,000 under the year-to-date budget, and expenditures 9% or $1.4 million under the budget through period 9 close. Food permitting revenue has continued to come in well under budget, and in Q3, the revenue generated from development and subdivision and on-site plan review was not quite high enough to offset the losses seen from food permitting. That happened in Q2. And so what we're anticipating is higher food permitting numbers for the last 3 months of the year as Arizona's opening continues, and I'm forecasting the fund to end structurally balanced. Our expenditures are so much lower than what the budget has been through Fund 506 that we shouldn't be in any difficulty by year end, even though we're seeing this impact through food permitting being lower than expected. Do you all have any questions with this Q3 update before I progress to the fiscal year 2022 budget request?
Any questions from? Oh,
if there's nothing, okay, thank you, Mayor. So for our Fund 100 revenue in fiscal year 2022, we are requesting a 44% increase in budgeted revenue from fiscal year 2021, which is from roughly $327,000 to $471,000. So this increase, it reflects the consistent trend that we've seen of higher activity in transfer station collections over the last several years. And in addition, there was a transfer station fee increase that occurred this past August of FY21 that's resulted in much higher levels of revenue. Fund 100 expenditures for FY22 is requested to match the same number as FY21 at $10.2 million. And we are submitting a non-recurring request for 5 foggers that we use for mosquito repellent and we replace these each year. And this will total $73.5 thousand total, or 12.5 per fogger. And I explained, that next point there. So with Fund 290 operating revenue and expenditures, they both match the budgeted rate as fiscal year 2021 at $5.825 thousand or $1 million there. We're putting in a non-recurring request for $850,000. That's the same thing that we've done this year for to reflect this difficulty that we've seen with the tire fund receiving less money from the state. So this is a preemptive move in case it continues. We're hoping it doesn't, but if so, we can take this money out of our $2.3 million fund balance and allow it to keep on functioning. We won't have to put in another agenda item to the board halfway through the year. If it doesn't, we will have no effect and nothing will be taken from the fund balance, and we'll be in a fine spot there. For Fund 506, the fee fund, operating revenue is requested at $21.9 million, which matches the FY21 request. Fund 506 operating expenditures are requested at $2.94 million, which also matches the FY21 request. Due to increased permit activity in the water and waste subdivision and on-site plan review programs through FY20 and 21, 2 positions were added to the requested FY22 budget, which brings our total position in this fund to 226. The fee fund has a non-recurring request, which totals $2.5 million. This is to be taken from our $13.8 million fund balance for FY22, and this will include the following. Environmental services portion of ITC technology contracted services, primarily in the form of SEPTEC, for $70,000. $100,000 for implementation of an electronic signature technology package, along with several other smaller technology implementations. $130,000 requested for overtime for personnel working delegation deadlines. Rent expenses will total the amount of $150,000 for the final months of us living, renting in this 3,800 building. FMD costs for our move to the 301 building in downtown, which will amount to roughly $797,000. Computer replacements, upgrades, and other tech supply purchases, which we're anticipating will cost around $200,000. We wish to replace 10 vehicles to meet the 15-point replacement threshold, which will cost $300,000 total. And finally, an RFP costs for our department-wide Acela replacement and enhancements, which will amount in $800,000. So this fiscal year 2022 request allows for our continued implementation of environmental services programs consistent with the goals specified in our strategic plan. Thanks for in advance of recommending this. And are there any more questions on the fiscal year 22 request that I can answer here?
Any questions from the board? Okay, so we need to vote a recommendation to the Board of Supervisors for approval of the year 2022 environmental. If we recommend forward to the Board of Supervisors, or we don't recommend that it moves forward to the Board of Supervisors, and that we approve of the budget, I think that would be the. And let me state that again. Does the Board of Health recommend to the Board of Supervisors approval of year 22 environmental services 2020 budget? Anyone approval?
Mr. President, Scott Seeley, recommend that, or I move that we as a board recommend to the supervisors the adoption of the recommended budget.
Okay, thank you,
Mr.
Scott.
Chairman, this is Don Casano. I second that motion.
Have a vote, please. All the of recommending supervisors approval of the fiscal year 2022 environmental services budget, please say aye.
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 Opposed? No. The ayes
Thank
carry.
you.
Thank you very much, Ryan. Appreciate the presentation.
My pleasure. Thank you.
So on the agenda is air quality, Greg Faircamp and Kimberly Butler. And I'm looking to recommend our decisions to supervise approve the provisions to the following rules. We'll hear them one at a time. 3.2 and 323, which I think you're together. If I think I understand that correctly. Greg or Kimberly, do you want to go ahead and present 323?
Sure. Can you hear me now?
Yes.
This is Greg. Okay. Excellent. Good afternoon, Mr. President, members of the board. My name is Greg Merkamp, and I am the planning supervisor in the Planning and Analysis Division of the Maricopa County Air Quality Department. And I'm here today with Kimberly Butler, who's the manager of the Planning and Analysis Division. We're here today, as you kind of seen on the agenda, to first respectfully request your recommendation to the Board of Supervisors to approve the proposed revisions to Maricopa County Air Quality Rules 322, 323, 324, and 336. And second, we're here to request approval of expedited process rulemaking for Rule 370. So I'll go ahead and start off talking about the first four rules that I just mentioned, Rules 322, 323, 324, and 336. The department's proposing to revise these rules to address rule deficiencies identified by the EPA. The proposed revisions are required to secure the rules approval as part of the Arizona State Implementation Plan under the Federal Clean Air Act. The department's also proposing revisions to address rule recommendations provided by the EPA, incorporate revisions recommended by stakeholders, and make other revisions to improve and clarify the rules. We've held multiple stakeholder workshops for all the rules to discuss the proposed revisions with stakeholders, and we've posted notices of the rulemakings on the Maricopa County Enhanced Regulatory Outreach Program website for stakeholders to review and comment on the revisions. And as you probably saw or have seen in the Board of Health reports that we forwarded on to you, we received comments on all of the rules, and within those reports, we've provided responses to all of the comments. There is, however, one comment in particular that we'd like to discuss a bit further right now, because in our report, we stated we would provide a formal response to the comment during this meeting. And I'm referring to the comment and response found on page 74, if you have that Board of Health report in front of you for Rule 323 or Rule 324. We received that comment shortly before the posting deadline for that report. So we did not have a sufficient time to analyze and consider the comment and draft a response before we were required to post the report to the web and forward it on to the board. So we've since had time and have made some revisions to Rule 324 to address this comment. The revisions were provided to you in an email earlier today, so hopefully you had an opportunity to review that. And I'll just briefly go over the revisions just for everybody that's listening. So specifically, we added language to section 102.1D regarding the applicability of the non-road engine records requirement in Rule 324. Section 102.1. Yes.
Great.
Go ahead.
Would it be okay, because if the board has questions of each of these rules get a little bit convoluted, can you mind if there's any questions of Rule 2 or 323 before you go on to 324? Would that be okay?
Sure, we can take it however. Yeah, we're kind of, and that's fine. We're kind of grouping these, just so you know, into the first four rules. We're looking for a specific recommendation to the Board of Supervisors, because, and that's 322, 323, 324, and 336. We had brought these rules previously to the board back in February 2019 to initiate the regulatory change, and now we're just coming to sort of get your final recommendation to the Board of Supervisors. So if there's any question, so Rule 322 would be the first rule if anybody had any questions. I was going to get to the question part here, but we can.
Okay.
I just wanted to, I kind of wanted to address this comment because it was something that was left outstanding in our report to follow up with. So.
All right, if we need to finish 322 and 323 and 324, so we don't get too far ahead. Would that be okay?
Yeah, I'm sorry you cut up a little bit. Did you want me to finish up on this? Just what we did for to address this.
Yeah, why don't you finish 3, stop and see if there's any questions.
Okay, I'm just kind of summarizing what was emailed to you earlier here today. So as I was saying, we added language. This is Rule 324. So we added language to section 102.1D regarding the applicability of the non-road engine records requirement. Basically, we just wanted to add some additional language in there to specify which non-road engines in Rule 324 we want to regulate. And so we added some language in the applicability section, basically narrowing it down to just those types of engines that are kind of like generators. We didn't want to be regulating non-road engines such as, backhoes and bulldozers. So we revised 102.1D as you probably saw in that email. In addition, we revised section 502.6 of Rule 324, and I'll just read what the revision we made here. And this again is for non-road engine records. An owner operator of a non-road engine shall maintain the following records for each non-road engine. And it says A, date that each engine is brought to the stationary source, and B, for engines located at a stationary source greater than 14 consecutive days, owners must maintain records of the make, model, serial number, and rated capacity of the engine, the date of each instance in which the engine is moved from its existing location and the reason why the engine was moved, and fuel type and sulfur content of the fuel. And so we added this language, quote, for engines located at a stationary source greater than 14 consecutive days, end quote, to limit the record keeping requirement for those non-road engines or those generators located at a stationary source for less than 14 days. So we didn't want stakeholders to have to keep all these records for just a rental. A generator came and went off on site very quickly. And so that's, we spoke to the stakeholder who submitted this comment last week, and they were satisfied with the revisions that we made to address their concerns. So I just wanted to point that out as far as Rule 324, because we said in our report that we would address it formally during this moment. But we can take questions at this time. Any questions you might have on any of the reports for Rule 322, Rule 323, Rule 324, Rule 336.
Okay. Are there any questions on, if we could take one rule at a time here, Rule 22, plan operations? Any questions from the board? Now, Greg, let me ask you just for my clarity here. These regulations regarding air quality and environmental are rather complex and sometimes hard to understand. In this process we're going through right now, I've gone through and being to be submitted to the EPA, and it would be included in the SIP plan. If whatever's approved would be submitted in the SIP plan. If true, correct. And I'm trying to make sure I'm clear in my thinking. I'm looking really with a lot of scrutiny, because I have concern in passing rules that may on the road be seen as being maybe we did the right thing at the time. True with these, in the case of Rule 322, Rule we have yet to talk about 336, that these are going to be the SIP, the State Implementation Plan. Because of that there's an EPA vision of backs. If the county passes something here in a rule, and later the county realizes or desires to try to loosen the restriction or changes the restriction we had added, that it really is next to impossible to make those changes because of the anti-legend with these rules right now. Do you understand that correctly?
Yes, and I'm sorry you were breaking up, but I think I understood the basic idea here is the concern that well, you're pointing out that yes, these rules we are going to be submitting to the EPA for approval into the state implementation plan, and yes, once they're in the SIP, generally the EPA frowns on any relaxation or backsliding, as I think I heard you say, regarding the provisions that are approved by the EPA. I would mention though, hopefully to address some of your concerns, two things. Number one, we've worked closely with the EPA on these because they were the ones that identified the deficiencies, and also because there are consequences if these rules do not get ultimately approved. It could lead to sanctions for the counties, including offset sanctions and highway funding sanctions. So we've been working very closely with them to make sure we're addressing the deficiencies that they identified, but at the same time, we've been working very closely with stakeholders. As I mentioned, we had multiple stakeholder workshops for all of those rules. Spent a lot of time with stakeholders, trying to address their concerns. Where we could, we made revisions to hopefully address their concerns. There's other areas where, we're told by the EPA that this is a deficiency, so we had to address it, and we couldn't necessarily, change it. But we worked very hard with both the EPA on one side to make sure that these rules get approved and we don't have any negative consequences or sanctions against the county. On the other hand, we did as much as we could to work to reach out to our stakeholders, have workshops, take their comments, and as hopefully you saw in all of our comment and responses, we did our best to respond to every single one of those comments that came in.
Thank you. Yeah, yes, Greg. Yes, Greg. Thank you for. I too. There was a comment from Suzanne Kennedy, and discussing not having a good reason to regulate the new additional requirements in this proposed rule for tracking of hours and day duration. Just that is not be determining compliance. Now, I've had years, and I've known Suzanne. I remember she ran for so she was a person that air quality rules, and I saw her email in there, and I was gonna just ask, why did I didn't see a response to that part of it. The county just said, I mean, her is on page 72 or so, depending on the verb. And she, again, I think manager at the county, and I know she was in air quality. And so when she made that comment, it struck me, new requirement that she said, again, she could not see how that would be needed to determine compliance. So what was the reason for the county? This is going to be, this rule needs to meet RACT. Contrology, is that correct?
It does, yeah, it does need to be RACT. And that record keeping requirement is in the current rule, so that it's on the books right now. So the current rule requires the days and hours of operation currently, like the one that's been enforced since 2016.
Gosh.
So,
okay,
yeah, it's not a new requirement in the proposed rule. I think she was just saying it's previous to 2016, it wasn't in there, but it's something that the power plants, we had constant discussions with them on this rule, and that was not among the many other revisions. That was not something that came up as a major concern for the power plants.
I think that I'm looking at this. It looks like ASU. I've heard in the past ASU has its own power for that, the details of that. But is there a reason why you would incorporate the daily and the hourly? Is there a reason for compliance? This up because again, the preface is that once this goes into the SIP, to pull it out on the road, because it would be highly unlikely the EPA would not allow that to happen. Is the that I have, unless you could correct my understanding. The days and hourly operation is required for compliance.
Yeah. Hi, this is Kim Butler. I'm going to go ahead and jump in here on this a little bit too. The days and hours of operation assist in an ability to determine if they're working within the number of fuel that they're permitted to burn to run the turbines. So it assists them in doing that. And for the most part, these are actually automatically tracked by the systems themselves. They just have to provide us the records out of the system that actually runs the turbine and the control emissions systems. So there's really very little additional work on behalf of those who are doing it. They just have to produce those records out of that. And it enables the inspectors to better be able to see if they're staying within their permitted limits for fuel usage.
Okay, so you feel that it's required for compliance to?
Yeah, and it also assists us in making sure that which fuels are being burned at which times. If there's ever kind of a curtailment, most of them run on natural gas, obviously, but if there's ever kind of curtailment, most of them are permitted to run different types of fuels. So we want to know the hours and such on those kinds of things. Not likely to happen, but again, like I said, most of these systems actually track that for them. So it's not that somebody's going to have to sit there and write down every time it turns on and off.
Right.
They just need to produce that too.
I don't know, maybe the case of the big power plant, but ASU would be on the smaller scale. Because again, Suzanne's, she the fuels automatically, and
Yeah,
that would be a
and even
control.
theirs does.
That would be their permit limit, correct?
Yeah,
I
but
believe that
even theirs does
ASU
track
falls
it.
under 323. Yeah.
Excuse me? I'm sorry.
320. Yeah, 323. I think, are you referring to the turbine out at ASU? That falls
Yeah,
under 323 regulation. So.
Yeah, theirs aren't large enough to fall under the power plant rule.
Gotcha. Okay. All right. Thank you. Okay. On Rule 322.
Yeah, they won't be under that anyway.
So this has ASU. So if I know ASU generator exempt from this. Is that
Yeah, I'm sorry,
they would be?
sir. We missed everything you said.
Oh,
I didn't hear anything. Sorry.
Sorry. So in the case of like an ASU, this is, I guess, an ASU, it would be exempt this provision because they're
Their equipment falls under a different rule. So 323 would be regulating. I think what you're referring to is their turbine.
okay. Well, 72 322 is saying I move the requiring of data operator and fuel to be the fuel be used required to be tracked monthly. That's what she has on Rule 32, Section 501.1. So is that a miss? Did she miswrite that then? Is it Annie?
I'm sorry, you broke up quite a bit again. I don't, Kim, did you catch? I'm not quite catching the question.
Oh, you mentioned, well, it's not in Rule 322, and he has that in her email. That's what I'm confused.
Oh, I'm not sure why. If you're asking why she commented on 322, I'm not sure. Maybe she just, I couldn't see.
Okay. A question for. Let me ask you one more question before I move on. There was on comment number 2, there was to clarify electric utility steam generators. And there was, I didn't see that the county wanted to do that. How would you determine if you had a burner or a heat generator? How would someone know if they're subject to the rule? As I understand, some of the duct burners and heat generators are subject to the rule. Understand this correct, or am I getting this correct? Regarding comment 4.
Again, we broke up quite a bit. So if I'm understanding the question correctly, most of those heat generators and that are going to fall under Rule 323 and 324 because those are our fuel burning rules. 324 mostly for generators and pumps and things like that, and then 323 is mostly the boilers and the steam generation units.
Gotcha. Okay. All right. Any other questions? Anybody else? Questions on 320? Okay. So if we could vote on 322, okay. Do I have a motion to approve 322? Our approval of recommendation to the board of advisors for Rule 322 to be considered board of supervisors on it. Do I have
Mr. President, are you doing each one of the rules separately or as they are listed as AQ 2017-007, which covers 322, 323, and I believe 324?
Right. Well, I'm not sure how the rule together if we do them as a group.
Yeah, I
Any
think
sense, Don?
if I could just comment, I think in the first back in February 2019, it was as a group. That's why we kind of that number that we generate is as a group together. So initially, and I can look at the report here real quickly, I think that they were voted on as a group, 322, 323, and 324.
President McMillan, this is Vera, members of the board. This is Vera and Max. I believe it's okay if you were to ask the board members if they're okay with making a recommendation to the Board of Supervisors to approve the proposed revisions as stated on the agenda. And if there are any nays, then you could maybe do individually. Would that be acceptable?
Sure, we could try that.
It's Robin. There's just a clarification about C is a different, it's approved expedited process rulemaking for the following rule. So is that one different than the other?
That one is completely separate, and that is a separate agenda item that we would like to address.
So we keep that one
from
separate.
these.
Yeah,
Yes.
yeah, we'd like to keep that one separate.
Yeah. Okay. All right.
Okay. So
Well,
I've got a question on 324. I had no questions. For this, let's see here. Let me look at my notes here.
well, it's Robin. Can I make a recommendation to the Board of Supervisors to approve the proposed revisions to the following rules?
I'm sorry, one moment. I apologize. There's a question from the public,
Sure.
the audience. Could I get a clarity on the proposed Rule 324 change is the question to the board or to air quality. They're asking for clarity on proposed Rule 324, please.
Yes, and I think it'd be better to vote on these individually. If we don't, if someone has an issue with any of the rules, it would be hard to vote on them and not think that rules that are here for that we're voting on would be not necessarily for the board. Vote the rules separately. If it was an issue, you would be able to understand that which rule was the issue. Would that be okay? Would the board have an issue with that?
No, that would be fine.
Okay, so once again on rule.
Mr. President,
Yes.
while you can vote on it like that, the question from the public to air quality is they are simply asking for clarity from them on the proposed Rule 324 change. So before you do any voting, if you can address that one question from the public. Thank you.
Sure. Thank you, Max. Okay. So, Greg, do you see the question from the public there? Do you want to have that question repeated again?
I'm not seeing it here. All I heard is that a question from the audience. Could I get clarity on the proposed Rule 324 change? Is it referring to the one basically in Rule 324? I think if the question is about the non-road engines, I can speak to that real briefly. Basically, there's a requirement in Rule 324 for non-road engines, which Rule 324 regulates stationary generators, basically. Non-road engines are not considered stationary. They're generally considered engines that are portable or move around. But sometimes some companies will use what's called, quote unquote, a non-road engine and say it's a non-road engine, but it won't move. And a non-road engine, like a generator, will become a stationary engine if it stays in the same spot for 12 months. So what we're trying to do with this new records requirement in Rule 324 is to make sure that any engine that a source brings out onto their property, if it's truly a non-road engine, then it's something that's moving around. It's not staying in the same spot. If it does stay in the same spot for more than 12 months, then it will fall under full regulation of Rule 324. Is that, I don't know if that's the clarity they're looking for, but hopefully that's.
Does a member have further questions on that? Vera,
I don't
can
see any
you?
additional chats, President McMillan. I believe you can proceed.
Okay, very much. So, so on rule 322, do I have a motion to approve recommendations that the Board of Health recommend to the Board of Supervisors approval of 22? Do I have?
Well, this is Robin. I just would like to say, if nobody, if the public doesn't have any more questions and we don't have any more questions, I don't see a problem just approving, moving all of those forward. You know, not including 370, which we have to have a separate motion for.
Okay, I have further questions on 6. So, I think that I prefer to vote on these individually because they are separate rules, and lumping them up, then we won't know which rule the nay was on. Is that
Yeah, sure.
reasonable?
Okay, well, this is Robin. I'll make a recommendation to the Board of Supervisors to approve proposed revisions to the following rule of 322. Rule 322.
Say you motion to approve. Was that
Motion
did I hear that?
Motion to recommend, correct?
Motion to,
recommend.
I'm reading from the minutes, from the agenda here. I make a recommendation to the Board of Supervisors to approve the proposed revision to the Rule 322.
Don Casano, I'll second that motion.
Okay, all in favor, please say aye. Aye.
Aye.
Aye.
Those opposed, say nay. Okay, for Rule 323, do I have a motion of Board of Supervisors, the Rule 323? Do I have a motion?
It's Robin, I'll make that motion. Do I have to say it all again or make recommendations to the Board of Supervisors to approve the proposed revisions to Rule 323?
Thank you, Robin.
Chairman Don Casano, I'll second that motion.
Roll.
All 3 of the Board of Supervisors say aye.
Aye.
Aye. Those against say nay. Motion passes. Okay, now before we Rule 324, I have no questions on that. Anybody else have any questions on Rule 324 or members of the? Okay, do I have a motion for approval of recommendation to the Board of Supervisors for Rule 324?
Yes, this is Robin. I will make Robin Schaefer. I'll make a recommendation to the Board of Supervisors to approve the proposed revision to the following Rule 324.
Thank you, Robin. Do I have a second?
Mr. Chairman, Don Casano, I will second that motion.
Thank you, Don. All in favor? Recommendation?
Aye.
Go ahead.
Aye.
All those opposed say nay. Okay, the ayes have it on Rule 324. That motion to recommend to the Board of Supervisors passes. 330.
Okay, Robin Schaefer makes the recommendation to the Board of Supervisors to approve the. Sure.
Greg, did you have anything more to add? Rule 336? Did you? I think did you cover Rule 3? You did, didn't you?
Yeah, we like I said, they're all kind of these rules that have been under EPA review, and EPA identified deficiencies in all 4 of these rules. So we're looking for a recommendation for approval of the revisions to the Board of Supervisors.
I got you. Before we enter questions, I have just a couple of questions. On page 92 of Rule 336, for me it was page 9, which national industry for finishing coatings. They were finding that the new VOC limit remained for a couple of reasons. They mentioned in their letter that one of the One was that consumers will not have a variety of options for these products, and the market will be limited if these products, the VOC limit is raised. They discussed in their letter on page 92, it'll take many years to potentially accommodate and test formulations for different types of water or temperatures or fouling conditions. The response that the county had on page 17, roughly page 17 in your document, it was comment or response number 2, was it would go ahead and change the lower limit, matching those from other counties. Can you explain the logic of that, where you have a group who, experts in finishing coating, recommending something, and the county is wanting to do something different here? Can you a little bit more, Greg?
Yeah, yeah, we had to lower that one to match the control technique guideline. And again, this all goes back to having to revise these rules to meet RACT, which is required by the Clean Air Act. So, Maricopa County was designated a moderate non-attainment area for the 8-hour ozone NAAQS, National Ambient Air Quality Standard, back in 2016. And because of that, the Clean Air Act requires that all your rules, to which there's what's called a CTG, or control technique guideline, that's been issued for those rules, that you have to make sure that your rules meet RACT, reasonable available control technology. And generally, within these control technique guidelines, there are recommended emission limits, and that the EPA says, those for the most part are RACT. It's not always the case, but for the most part it is. So in this case, we lowered it to meet that. This was an EPA recommendation, as we mentioned in our response. The EPA recommended it. I would probably say strongly recommended it, and we didn't want to jeopardize the approval of this rule and ultimately, the possibility of offsets or losing highway funding. We didn't want, any sanctions to come down on the county. So that's why we considered this. We did speak with the the Coating Association. We told them we are more than willing to reach out and work with their members. Our business assistance folks are working with them now. So we have made some outreach to them. And we also made this comment, and we had a workshop and discussed this with stakeholders back in last July. So this has been known by stakeholders for over a year now, to kind of go out and they've had time to use up the coatings that are going to be out of compliance, and time to research and find new coatings to be in compliance with, we think, almost a year now.
We also reached out to those that knew were using this or potentially could be, and we didn't find anybody in the county who was using it on any kind of significant level. And many counties in California were already using it. So there has been a lot of testing already going on, because they do have this. So but we found that there was really very, very little use of anything that was above these VOC limits anyway. So the impact is very, very minimal, if at all, at this point.
Right. Well, some of the concerns I have on that is, the CE, as I understand, is it's a guide, it's not a requirement. Is that correct?
It's not a requirement, but it is what the EPA often looks to when it's determining RACT, and RACT is a requirement for ozone non-attainment area. So it's right. Indirectly in this case. Yeah.
Yes, and so we're in the rain, which is San Francisco. Counties that, because you mentioned that counties had adopted this limit, and those counties would have been counties in California that, for the most part, probably don't have much industry left. So when region looks at their pool counties that have done things as far as the CT, they're looking at counties around them that have South Coast rules that have been applied. So therefore, their requirements in those areas have been way more stringent than ours. What I'm describing, does that seem correct?
We are part of Region 9. Yeah.
Yeah.
I'm sorry, what?
Go ahead, Kim.
Go ahead, Greg. Oh. There are occasions when we do look at those other counties. We have to compare ourselves against counties. We do it across the country. And we did compare ourselves against a number of places, including California. And as Greg was saying, we are part of Region 9, so that's the highest area of comparison, and that does get us compared with those limits. We also look at how this is locally affecting our businesses. And like I said, there was minimal to no use in anybody that we talked to, and so we weren't concerned that this was going to have an effect on the businesses per se on that. So from that aspect, we did stick with that. When we talked with the ACA, they did say that they've had this similar conversation around the country, and most everybody was not changing this. They were all sticking with the CTG because in the various regions, that's what was happening with that, especially as more and more of us go into non-attainment and have SIPs that are really stricter, and we're going to be, the way our numbers are looking, we're going to be bumped up in our non-attainment for ozone. So we wanted to get these rules locked down with the limits that are in them, so we don't have to touch them. They'll be considered racked if they're recent. So we can get these locked down with these limits. It means that we don't have to start looking at stuff that's lower than the CTG in order to get the offsets and the credits that we need in order to show reductions in ozone.
I understand that,
and I think.
Go ahead, Greg. Mm-hmm.
I was just going to say, I think ultimately, a major concern here is, I understand your concern, and we do, that's why we have stakeholder workshops. That's why we take comments. That's why we do everything we can. But we're really on this sort of, we're in this balance beam, as I see it, with all of these rules. You've got stakeholders and their needs, and there's certainly ones that we always take into account, and we do our best as far as we can. But on the other hand, we have the EPA that's identified these deficiencies and has made these recommendations. And if we fail to heed what they've recommended, there can be other consequences that can impact the county, such as the federal highway and offset sanctions that we really have to take into consideration.
Absolutely. Understood, Greg. So in this regard, this is one of those rules that will be a no backsliding rule. So if the county look a year or 2 years from now and can't do that, then it'll be very difficult to reverse these higher limits. Is that?
Yes and no. I know that sounds like a great government answer, right? But yes and no. If we can show, based on environmental conditions, because obviously Arizona, especially Phoenix, is an extreme environment, that these are no longer, that these do not work. We have on occasion been able to raise limits in situations like that. It takes a lot of proof, it takes a lot of background, and it takes a lot of work with the stakeholders. They have to work with us in this as well, because they're the ones who have the data and the experience. Does it happen all the time? No, but it is backsliding. If we can show it's not backsliding because we are creating a economic issue, and we can find another place to get those credits or get that and balance it, we have been known to be able to do that. So that's not to say this never can happen. Now, it's exceptionally rare. And like I said, we try to reach out and make sure that we're not going to run into that situation. And that's what we did in this situation, is we directly contacted everybody that we found that through our permits and such that we believe might even possibly be using this, and made sure. And so we're confident that we're not going to need to change this down the road, because they've already told us either they're not using it or they use it so little that they can switch to something else without an issue.
Okay, I have no questions. Does anybody else have any questions? Anybody from the public that has any questions regarding Rule 3.6?
There are no hands up, sir.
Okay, thank you. Motion for Rule 3.36. I should say not approval, but should I information board Measures for Rule 36, the surface coating operations.
This is Robin Schaefer. I'd like to make a recommendation to the Board of Supervisors to approve the proposed revision to the following Rule 336.
Mr. Chairman, I'll make a motion for a second to that motion. Don Casano.
Thank you, Don. Okay, all those in favor recommendation to the Board of Supervisors for Rule 336, say aye.
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 Those opposed say nay. And Bob McMillan is a nay on that. Okay, thank you very much. The motion is approved for the recommendation to the Board of Supervisor for Rule 336. Okay, so now we're on to Rule 370. Kimberly, could you please go through this?
Sure. Rule 370 is our rule that basically covers our hazardous air pollutant program. Most part, we're not touching this when we do. This is part of our adoption by or incorporation by reference that we do every year with that for the federal hazardous air pollutants. But there is one section in this that has to do with asbestos. And so for asbestos, we wanted to clarify that, make some changes. It hadn't been updated in a number of years. So we did, we knew from the industry that there was a lot of confusion. There's a lot of misunderstanding. The Code of Federal Regulations that this is based on is very convoluted. So we needed to create some clarification here. So we held a stakeholder workshop. We made extra efforts. We reached out to anybody who'd gotten a notification on asbestos. We reached out to them and made sure that they were okay with that. We reached out to the Asbestos Institute, who does the training for and certification for asbestos workers, and we worked through all of that with those parties and made significant changes to this to make clarifications. And in this case, we actually reduce some of the regulatory burdens that no longer had any kind of environmental and health impacts, we felt. So, and from our experience and from the experience of the workers out there, we removed some of that out of that. So it actually reduced some of the regulatory burdens. This is not in the SIP, so we do have the opportunity to have a little more localized rule for this. Now, we did send out to you today that we did have one last comment that came into us late on Thursday. So we, from the Asbestos Institute, they reread it through and they wanted to make one last change. So we did change the exemption. The exemption is for residential units. Basically, if you own your own home and you have asbestos in it, you're not regulated by this rule. And we wanted to make that very clear that was the case. So we did change that exemption there to shall not apply to demolition or renovation activities, including any single owner occupied residential parcel which contains 4 or fewer detached dwelling units. This was our way of kind of, excuse me, of scooping this in and making sure that we would get anything that was commercial or was going to be large developments and that which the Code of Federal Regulations intends. But if it's the house with a casita or the house with a mother-in-law suite or whatever it may be, those are not intended to be caught up in this regulation, and we wanted to make that clearer. So that's not included in the packet. That would be included in the email that we sent out to you showing that change. We talked with the stakeholder, in this case the Asbestos Institute, and they were perfectly fine with this change, and then they were very supportive of a lot of the other changes that we're making because it will make regulation easier, and both from the regulator and the regulated side. So if there's any questions, Greg and I'd be happy to answer any of those.
Thank you, Kimberly. Is there any questions from the board?
Well, this is Robin Schaefer. It's just clarification that because you're now making changes to the rule, that's why we need this moving the expedited process of rulemaking to the Board of Supervisors for this specific rule.
Yeah, the expedited is in response to some of the comments we received. We received some both in the workshop and then from others that they want this to be in place as soon as possible. So the expedited gives us the opportunity to bring it to you guys only once instead of having to bring it back again a second time. So we can immediately move from this to our notice of proposed rulemaking and then onto a Board of Supervisors agenda and make these changes in place. These changes will actually save, especially large companies and municipalities. We anticipate a significant amount of money because they're not going to have to do surveys as often. So when there's no changes, they're not going to have to redo surveys in places there's no changes. So that's one of the big changes on this. And so that's why we were requesting expedited, is we've had nothing but support on this, and we really wanted to get this in play as soon as possible.
Great. Okay. Thank you.
Thank you.
Thank you, Kimberly. Any other questions or concerns from the board in regard to voting on the expedited process of Rule 370? Any other questions or concerns? Is there anybody from the public that has any questions regarding Rule 370?
Mr. President, there are no hands raised.
Thank you very much. Do I have a motion for approval of the expedited process for rulemaking for 370, the air pollutant program?
Yeah, this is Robin Schaefer. I'd like to make a recommendation to the Board of Supervisors to approve an expedited rulemaking process for Rule 370.
Mr. Chairman, this is Don Casano. I will second that motion.
Just for clarity on what we're voting for, this would to the County Board of Supervisors, or this would go back? Are we voting? Can you clarify for me if we're voting that this would be supervisors, or are we voting that expedited and go back to the county? What is the process on that? Can you clarify for me?
Yeah, this what you're voting for is the expedited. It's not a recommendation to the Board of Supervisors. It's just basically allowing us just to go one time here in front of the Board of Health because we haven't had any comments of opposition. If we have a rule with no comments of opposition, the EROP process allows us to request a expedited. So it's not a recommendation. It's actually you all approving this expedited process. We still have to, after this, we'll have to publish a notice of proposed rulemaking on our website, give folks another 30 days to look at it, comment on it, and then we go to the board, directly to the Board of Supervisors after that.
Great. Robin, do you still want to make that motion?
So is the motion then just to approve the expedited process of rulemaking for Rule 370? Is that correct?
Correct. Correct.
That's it then. That's my revise.
Mr. Chairman, Don Casano, I'll revise my second for that motion.
Thank you, Robin. Thank you, Don. Thank you, guys. Okay, do we have a motion to approve the expedited process 370, the federal HAPS air pollutant program? All those in favor say aye.
Aye.
Aye. Those opposed say nay. The motion carries. Expedited process for the Rule 70. Greg, Kimberly, is there anything else you have to include your presentation?
That concludes the course. We appreciate the time. Thank you.
Thank you, guys. Thank you very much. And I've seen the air quality department seen over the years of an excellent job of ensuring that we have a clean Maricopa County and trying to balance that rulemaking processes and dealing with entities like these. Appreciate and the work you guys have done over there. Thank you.
Thank you very much.
Okay, so we're on to the next agenda item. Fee waiver application. Ken?
Yeah, this is Ken. Can you hear me?
You can, thank you.
All right. Good afternoon, Mr. President and members of the board. This quarter, we reviewed 23 new fee waiver applications. The applications were reviewed, and we have determined that all of them meet the criteria outlined in the Maricopa County Environmental Health Code. As a reminder, only an operator of a charitable nonprofit establishment, which operates to provide relief predominantly for the poor, distressed, or underprivileged may apply to the Board of Health for a waiver of a permit fee. And a waiver of a permit fee may be granted only to the operator of an establishment which maintains our current 501c3 tax-exempt designation from the Department of Treasury Internal Revenue Service, and who demonstrates to the Board of Health that payment of said fee will cause a financial hardship. In addition, a waiver of fees associated with administrating the issuance of a food employee certificate in compliance with ARS 411080 may be granted to the operator of an establishment which again maintains a current 501c3 tax exemption from the IRS and also demonstrates to the Board of Health that payment of said fees will cause financial hardship. So once again, all 23 fee waiver applications were reviewed by our staff, and they appear to meet all of the criteria that I mentioned. If the board has no questions and is comfortable with our staff review, I respectfully suggest a motion to approve fee waiver applications that are found on your fee waiver application summary sheet, numbers P1 through P20 and C1 through C3. Thank you.
Mr. President, I would move approval of the fee waivers recommended by Environmental Services. Scott Seeley.
Mr. Chairman, this is Don Casano. I'll make a second to that motion.
Mr. President, you are on mute.
Thank you. I'm talking, but nobody's hearing me. Okay. We have a motion for approval of the fee waiver. We did a second. That was from Scott, did a motion. John did a second. Do everyone in favor of approval of applications, please say aye.
Aye.
Aye. Those nay? The fee applications pass. Thank you, Ken, for the presentation and all the work on your department.
Thank you, Mr. President. Members of the board.
Thank you very much. Do we have announcements or current events? Anybody wants to? As my notes show that what the board is putting on a future agenda, the health status report. Understanding is be added to the future itinerary in proper time frame before. Is that my understanding? Does anybody have anything to add or take away from the putting on the future agenda that earlier? That's what our follow-up is going to be for a future meeting, but maybe not the next meeting. Do I understand this correct? Does the board agree? Anybody have comments?
It's Don Casano. I agree.
So
this is Paula Banahan. I agree as well, but we would like to see the last year's report, if that's what Vera said she was going to be able to provide.
Right. Vera mentioned she was going to email that out to the. Yep.
Yes.
Thank you for following up on that. Yep. Okay.
Also,
great.
Mr. President, this is Paul Sander. I just, depending upon the length of the report and the issues and the time, it's conceivable that you might even consider like a special 1-hour meeting or something. Because we've already, this meeting's been pretty lengthy. But if we were to try to, I think it's going to potentially entail a considerable amount of time to discuss. So it just might be difficult to squeeze it into a routine meeting. Just throwing that out there too.
Gotcha, Dr. Stander. So in my experience, it's just this meeting today, was much more lengthy because there was a lot of county board air quality rules to be approved.
Okay. Yeah. I
For the board.
yeah.
Yeah,
I'll
but
leave it here. Yeah.
Yeah, but yeah, I don't want to mean that at all. I think when the agenda goes out, if anybody has recommendations on that, maybe they could email the group and say, I recommend meeting on this. It is a bit of a challenge to get everybody together. In some cases, you know,
Mr. President, this is Ann Longo. The open meeting rules don't allow all of the members to be emailing each other about agenda items and things. That would violate the open meeting rule. So it would just be something that could go on the agenda, or if someone has a suggestion for something on the agenda, they could send it directly to Vera.
Thanks for that clarification. Appreciate that. Okay, so Dr. Stander, if you have an idea, you could send that in to Vera.
Okay.
It's hard to get together and have a quorum without a lot of notice in advance. So I just mentioned that. So sure.
Understood.
So thank you for thank you for the board and the county for all the information today. And so I guess we'll adjourn this meeting. Do I need to have a motion for adjournment or just adjourn?
McMillan, this is Vera. Before you do that, Rebecca, I'm sorry, do you have any public raised hands or chat that President McMillan and the board need to address quickly?
No, we do not have any outstanding questions or raised hands at this time.
Thank you. President McMillan, I'm sorry. Now you can close out the meeting. Thank you.
Okay, so I'd like to adjourn this meeting today. And does anybody have any other comments or concerns? Are we okay to adjourn? Anybody have any other issues?
This is Ann Longo. You do need a motion to adjourn.
Thanks, Ann. Do I have a motion to adjourn this meeting?
So moved. Paul Stander.
Thank you,
Second,
Paul.
Robin Schaefer.
Thank you, Robin. All those in favor of adjourning this meeting today, say aye.
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 Those opposed, say nay. Motion to adjourn the meeting. Thank you, everyone.
Thank you.
Good night.
Thank you.
Good night.